Hi, my name is Sarah Wilson. I'm the nutrition manager at Gleaners Food Bank of Indiana. And today I want to give you an overview of our nutrition policy, why we implemented it, what its components are, and what this policy means for our food bank and for the community that we serve. So let's start by talking about why a food bank such as Gleaners would implement a nutrition policy. Well, let's look at the purpose of a nutrition policy. The purpose really is to serve as an official set of guidelines to maximize the nutritional value of the foods that we're procuring and distributing. It serves as a guide for consistent decision-making among staff members about the foods we acquire and distribute. And it can increase the availability of a variety of health-promoting, culturally inclusive foods that align with the healthy eating research guidelines, which was a new set of standards passed in 2020 that has been infiltrating the charitable food system since and has become a standard for measuring the nutritional quality of foods. A nutrition policy can also communicate a food bank's commitment to nutrition and health to the community that it serves. It serves as an official document to help explain and describe why we value nutrition and how we plan to implement more nutritious foods into our food bank inventory. This policy can also serve as a model for agency partners such as food pantries, soup kitchens, or other community centers to be able to assess the nutritional quality and cultural inclusions of the foods that they supply to their community. And most importantly, a nutrition policy is designed to positively impact the health and well-being of the neighbors that we serve. This is the ultimate goal and purpose, and exactly why Gleaners chose to implement a nutrition policy, which was passed in February of 2022. So let's watch a short video from Feeding America to get a little more background on how nutrition can be impacted by food insecurity and why this work is just so important.
What if you had to make the choice between meals and medicine? Between making rent and filling lunchboxes? What if you didn't have enough money to keep the power on at home and nourish a healthy body? 37 million Americans, that's 1 in 9, are food insecure. This means they lack consistent access to enough nutritious food for an active, healthy life. Our neighbors who are food insecure cannot always stretch their household budgets to meet their basic needs. Even with the support of federal nutrition programs or help from family, friends, and community organizations, food insecurity can have serious long-term effects on a person's health. Healthy bodies and minds at every age require nutritious meals. When people don't have enough food, when they consistently need to choose inexpensive, low-quality calories, or experience chronic stress about where they will get their next meal, their health can suffer. People who experience food insecurity are at higher risk for diet-related diseases, such as type 2 diabetes, high blood pressure, heart disease, and obesity. More than half of households served by the Feeding America nationwide network of food banks have at least one member with high blood pressure. 1/3 have at least one member with diabetes. When an individual or family cannot afford enough nutritious food, they sometimes adopt coping strategies and trade-offs that work in the short term to avoid hunger. However, over time, these can increase the risk for diet-related disease and make it more challenging to manage. This reality can lead to a cycle of poor health. The cycle begins when an individual or family cannot afford enough nutritious food. The combination of financial stress and inadequate nutrition can result in poor disease management. The time and money needed to respond to these worsening health crises further drains the household budget, leaving little money for essential nutrition and medical care. This causes the cycle to continue. Food insecurity also negatively impacts the lives of future generations. In the United States today, more than 11 million children lack regular access to nutritious food. Children at risk of hunger are more likely to be in poor health and struggle in school. For some, It may have negative lifelong implications that could prevent a developing child from reaching their full potential. Together, we can make real change. We can break the cycle and build healthy, strong communities. Join the Feeding America nationwide network of food banks as we work to ensure all Americans have access to the nutritious foods we need to thrive. Take action. Advocate, volunteer, donate. Visit hungerandhealth.org to learn how you can make a difference today. Together, we can end hunger.
I think that video really puts into perspective just how important it is for food banks and food pantries to provide the most nutritious food possible so that we can give our community members the best chance at reaching their fullest potential. I wanted to share just how important everyone's role is in formulating and putting into action a nutrition policy. This can't just be done by one individual or one department within a food bank or a food pantry, but it really requires everyone from upstream partners to the neighbors that we're serving to be on board for this process to be successful. So your role is very important, and we can't do this without you. If you have any questions about Gleaner's nutrition policy, you are more than welcome to reach out to me. My email is provided on this slide, and you can also visit our Nutrition Hub website at gleanersnutritionhub.org for more information and nutrition resources.